what we're seeing now, COVID is clearly a threat, but now, as you're seeing all over the country, there's stories coming out of Indianapolis this morning, Texas, Florida, Missouri, all over the country, hospitals are reporting that they're overwhelmed. In the middle of July, which is very unusual, it's very rare for hospitals to be overwhelmed. Yesterday, we had 90 patients holding in our emergency departments for inpatient admission. Today, that number's up to 119. And why is that happening? It's happening, number one, because prior to COVID, there was a national nursing shortage. Our nurses stuck it out through COVID, but as COVID started to recede over the last few months, our nurses were tired. They're tired. And we lost some of our nurses who decided they just didn't want to work at the bedside anymore. And this has happened again. This is a phenomenon that's occurring all over the country. Even as that's occurred, now our emergency departments are getting hit pretty hard with what we're seeing is a much higher acuity of patients. During COVID, as we've reported previously, there was a big reduction in the number of people that were coming to the emergency departments or seeking health care. And what we predicted was that we would see some of those patients who would end up with acute situations or more aggressive illness than they might have had they gotten the care a year ago. And so what we're seeing now is a higher acuity in the emergency department. And so it's resulting in the combination of staffing shortages with a higher acuity of patients and a higher volume of patients returning to the hospitals. This is sweeping the whole country, and we're no different. I would encourage folks I think it's important for people to understand what to expect. I think what people can expect is that if we're in the middle of July and this is happening, as we see an increased number of COVID cases that end up in the ER or in the hospital, and as we go into the fall, if we start to see an increase in flu cases, I think this is going to bring not just Ballad, but I think the healthcare system as a whole really closer to a breaking point.